If you're experiencing occasional constipation, Enema Disposable may be used to provide relief. However, it's important to note that milder products, such as stool softeners or bulk-forming laxatives, should be used whenever possible. It's best to consult with your doctor or pharmacist about other treatment options for constipation. In some cases, your doctor may prescribe Enema Disposable, along with other products, to clean stool from the intestines before surgery or certain bowel procedures, such as a colonoscopy or radiography. It's crucial to use this medication only as directed by your doctor. Enema Disposable contains sodium phosphate, which is a saline laxative that is believed to work by increasing fluid in the small intestine. Typically, it causes a bowel movement within 1 to 5 minutes after use. It's important to note that Enema Disposable should not be used in children younger than 2 years of age. And as always, it's best to follow the dosage and timing instructions provided by your doctor for the best results. When using this enema, be sure to follow the instructions on the product package. Before and after use, wash your hands, remove the protective shield, and insert the enema tip into your rectum. Lie on your left side and gently squeeze the bottle until the recommended amount of the drug is inside your rectum. Stay in position for 1 to 5 minutes until you feel a strong urge to have a bowel movement. If your doctor has instructed you to use this product before surgery or a bowel procedure, be sure to follow their directions closely. After using the medication, drink plenty of clear liquids as directed by your doctor. It's important to avoid using this medication more often or for a longer duration than directed, as it may lead to serious side effects. This medication may cause laxative dependence if used regularly for a long time. In such cases, your bowel may stop working normally, leading to ongoing constipation. It's important to consult your doctor if you need to use this medication for more than 7 days. Be sure to seek medical attention if you experience rectal bleeding or pain, do not have a bowel movement within 30 minutes of using the product, have symptoms of dehydration, or if you suspect a serious medical problem. You may experience mild abdominal discomfort, cramps, or gas when using this product. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has recommended the use of this product, it's because they have determined that the benefits outweigh the potential risks of side effects. Most people who use this product do not experience serious side effects. Prolonged diarrhea can lead to dehydration, which may have serious effects on the kidneys and heart. Contact your doctor immediately if you notice any signs of dehydration, such as a dry mouth, increased thirst, lack of tears, dizziness, lightheadedness, or pale and wrinkled skin. Notify your doctor right away if you experience any serious side effects, including severe or persistent stomach or abdominal pain, unrelenting diarrhea, changes in urine output, bloody stools, rectal bleeding, changes in mental or mood state, muscle weakness or spasms, and swelling of the hands, ankles, or feet. Seek immediate medical assistance if you experience very serious side effects, such as slow, irregular, or fast heartbeat, or seizures. Although rare, a serious allergic reaction to this product is possible. If you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This list does not include all possible side effects. If you experience any other effects not listed here, contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Enema Disposable, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of certain medical conditions. This includes dehydration, imbalances in certain minerals in the blood, kidney disease, stomach or abdominal symptoms, bowel problems, heart disease, and liver disease. It's also essential to consult your doctor before using this product if you've had a sudden change in bowel habits lasting more than 2 weeks or if you need to use a laxative daily for more than 1 week. These could be signs of a serious medical problem. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using. For young children and older adults, it's important to note that they may be more sensitive to the side effects of this drug, especially dehydration and kidney problems. During pregnancy, Enema Disposable should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's also unknown if this drug passes into breast milk, so consult your doctor before using it while breastfeeding. When using Enema Disposable, it's important to be aware of potential drug interactions that could affect how your medications work. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Enema Disposable include other drugs that may affect the kidneys, such as ACE inhibitors, ARBs, diuretics, and NSAIDs. The watery bowel movements from sodium phosphate may cause your body to absorb less of your regular medicines and get less benefit from them. It's important to consult your doctor or pharmacist about how to reduce this effect. Always follow your doctor's advice on the best time to use Enema Disposable and how often to take it. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include muscle weakness, a fast/slow/irregular heartbeat, changes in mental or mood state, such as confusion, and changes in the amount of urine. It's important to attend any medical tests or appointments scheduled by your doctor while using this medication. Additionally, to maintain regular bowel habits, it's important to drink plenty of fluids, eat high-fiber foods, and exercise regularly. When using an Enema Disposable, it is important to follow the instructions provided with the product. The enema should be inserted gently into the rectum and the contents squeezed out completely. It is recommended to use the enema at bedtime or as directed by a healthcare professional. The usual dosage for adults is 1 enema once a day or as needed. It is important to drink plenty of fluids while using this product. Enema Disposables are commonly used to relieve constipation and may also be used to cleanse the bowel before certain medical procedures. Always consult with a healthcare professional before using an Enema Disposable. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Do not freeze or store in the bathroom. Keep all medications away from children and pets. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.